Hi, my name is Chrissy, and today I'm going to talk to you about how I was diagnosed with multiple myeloma. In this video, I'm going to go over what my symptoms were, how I came about getting the initial diagnosis, and my journey through the first few years of being diagnosed with this condition. Multiple myeloma is a blood cancer, and I sometimes think of it as the cousin to leukemia and lymphoma because they're all grouped together as blood cancers. I was diagnosed with multiple myeloma in October of 2020. Now, when we talk about my symptoms actually started in October 2019, 1 year before. In October 2019, I woke up one morning and I was in excruciating pain in my hip. And I remember I couldn't put any weight on my leg. Like I couldn't put any weight on it. It was extreme bone pain. It was really sharp. And I had that pain for about a week. So I remember I was going on Amazon trying to buy little things to help me kind of get mobile around the house. I just basically couldn't stand on my own 2 feet. So I called my doctor and I went in to see my primary care physician. Well, they advised that I get an MRI. So I got the MRI and some additional blood work. And when the MRI results came back, they saw a spot on the top of my femur. So at the time, my primary care doctor felt that it was something called transient osteoporosis. So they advised me that we would get monthly checkups, monthly MRIs to just monitor it, and that in about 6 to 9 months it would go away. So they ruled out anything nefarious and they didn't feel like there was anything else going on. So, of course, I continued to get my monthly MRIs up until about February, end of February, beginning of March 2020. That's when the pain came back. And this time, it wasn't as intense as the first time, but it was enough for me to call the doctor and say, hey, something is going on. So when I called my doctor back and told her about the pain, she told me to see a bone doctor. But because the pandemic had just started, it was really hard for me to get in and get an appointment. So my primary care doctor decided that I should also see a rheumatologist. And for some reason, it was easier for me to get in to see the rheumatologist. So I went and followed up. When I went to the rheumatologist, they ran all the tests and everything came back clear. So we kind of were scratching our head about what the possible cause could be or if there was any other root cause to the bone pain. So about July of 2020, as if I wasn't already going through enough with wondering about my health, I actually started to go through a divorce. And that was an incredibly stressful time, a very intense time. And it just so happened after all of that started up, I had my next MRI appointment. And when I went to that follow up appointment, the spot on my femur changed shape and it got a little bit bigger. And when that happened, it really made my rheumatologist, raise her eyebrows. So the next time I went to my appointment, she recommended that I go see an oncologist. So I did go see an oncologist. Medical facility that I was going to, the oncologist was like right down the hall. So I was able to get in immediately and see them. When I went to the oncologist, they looked at my imaging and they felt like there wasn't anything wrong. There wasn't cancer. It didn't look like cancer. So she sent me back to the rheumatologist. When I went back to the rheumatologist, she was adamant and persistent that I get a biopsy done of my femur. And I was against it at first because I was like, I just came from the oncologist. They don't feel like there's anything wrong. And, there's nothing to see here. So I don't want to get a biopsy done because that just felt like it was so invasive. And I honestly, I was scared. But throughout that appointment, it took her about 45 minutes to probably close to an hour. She sat with me and persuaded me to get the biopsy done. So I went ahead and got the initial biopsy done. So when I went to get the biopsy, it was like a few weeks after that. So it was around September of 2020. And I got my results back the beginning of October 2020. And I'll never forget the day that I got the results back, because it's literally the day that changed my life. And I remember waking up, I felt like this was going to be my last time having to go back and forth to the doctors, and that everything was going to be resolved and I could get back to normal and not have to do all these follow-up appointments. So when I went into the doctors, I remember it took them a long time to come into the appointment. And when the rheumatologist came in, she brought in another doctor with her. I didn't think anything of it. I just figured she was, maybe shadowing her or something like that. So she logged into the computer and she looked at me and she said, the results of the biopsy state that spot on your femur is a plasmacytoma. And I had no idea what a plasmacytoma was. I'd never heard the word before, but I did know that anytime you have a word that has oma on the end, that it usually means cancer. So I broke down. I was distraught. I mean, all of the emotions I was feeling, everything was spinning around in my head. I felt gutted, because I wasn't sure what it was. I just had a general idea that it was cancer, and it was definitely not the news I was expecting to hear. So it just so happened that because I was so distraught, they had me call someone, and my really great sister friend came to pick me up because I just was so distraught. And they told me that the next steps were that I would go see a hematologist. So October 20th of 2020 is when I went to see the hematologist, and he ordered a lot of different tests. He ordered a bone marrow biopsy, which is not fun. Do not recommend. Okay, 0 out of 5. A PET scan and additional blood work to just kind of basically to begin the staging process to see where I was. And of course, when I found out about the plasmacytoma, I went on Google and I Googled every possible thing I possibly could. And that's when I found out about multiple myeloma. And I realized that this was connected to that. And I wasn't sure what stage things would be, but I was hoping that it was just one solitary plasmacytoma, and that would be, I could get some radiation and then move on. So when I got my results back, it was November 25th, 2020. It was the day before Thanksgiving of that year. And I went to my appointment. My sister had flown out to be with me because she was just an amazing support to me at that time. And I recommend, if you're going through anything like this, you need a support system. So I went to that appointment and he told me, unfortunately, I didn't have just one plasmacytoma. I had 3 plasmacytomas. I had one at the top of my femur, I had a large one at the bottom of my femur, and I had one in my right jaw. And he also said that the PET scan showed cancerous activity in other areas of my bone, including my ribs, sternum, shoulders, and both of my femurs. So it was not what I wanted to hear. I felt like I was gutted yet again, and I just felt overwhelmed. I wasn't sure what was going to happen. It's November the 25th. The diagnosis is high risk multiple myeloma, stage 1. So many things going through my head. I knew that because it was so extensive that I would be starting chemotherapy. And I also knew from my research that I needed to find a multiple myeloma specialist, because statistically it said that you have better outcomes if you see a multiple myeloma specialist. So I requested to see a specialist, and I was transferred to a specialist. So I started chemotherapy December 30th or the 31st of 2020. That was my first day. And they told me that I would be on a 4-drug regimen, because when they did my bone marrow biopsy, they saw certain factors in the myeloma that made me high risk. So they wanted to aggressively treat. So they started me on daratumumab, Revlimid, Velcade, and dexamethasone, which is usually standard treatment, except the daratumumab was something that they added to the standard treatment. So I was on that for 4 cycles or 4 months, and it brought my numbers down slightly, but I plateaued. And so my doctor felt at that time I should change my regimen. So they added a drug called Kyprolis. So I was on daratumumab, Revlimid, Kyprolis, and dexamethasone at that time. So I stayed on that treatment for almost a year, and it did have a side effect of stress on my heart. And that is one of the side effects that you commonly see with the drug called Kyprolis. So I stayed on it for a year, and it did bring my numbers down even more, but it did not put me in remission. So at that time, I had plateaued again, and I was stable, but my numbers weren't moving. So I had actually found out about a clinical trial in the summer of 2022. So June 2022, I approached my specialist and I asked him if I could participate in this clinical trial, because the clinical trial basically did another bone marrow biopsy, but they took the biopsy sample and they tested that sample against 160, 170 different chemotherapies to see which chemotherapy was most effective for your particular type of myeloma. So I was very interested in getting that data because, of course, I had not been in remission from the prior treatments, and I wanted to see which drugs would be the most effective. So we did that clinical trial, and I got the results back. The results surprised me because there were some medicines that were deemed effective, and there were quite a few that were not. Before the clinical trial information, my specialist wanted me to get a stem cell transplant because a stem cell transplant is standard care for a myeloma patient. And I had harvested my stem cells a year before just in case I was going to get the transplant. But one of the drugs that they use in the transplant, called melphalan, actually came back in the data from the clinical trial that it was not effective for the type of myeloma I was dealing with. So my specialist decided that the stem cell transplant was not the way to go, and that I should get CAR T cell therapy. And I had done a lot of research about CAR T cell therapy. I was on board with getting that treatment. So we started the process for CAR T cell therapy in October of 2022. And for those that don't know what CAR T cell is, it stands for chimeric antigen receptor therapy. And basically, they take your T cells, they extract your T cells, they send them to a lab. The lab attaches certain antigens to the cells to attack the cancer cell, and then they reintroduce those cells back to into your system. The whole process usually takes about 8 weeks to manufacture the cells, so you do have to wait for your cells to come back. So I had the process started in October, and I'll probably do another video on the CAR T cell journey. But they started the process in October, and I got my cells back at the end of December, and they gave me my cells January 11th of 2023. So at that time, I was inpatient in the hospital for about 14 days while they monitor you after they give you the cells. And I knew within about 2 or 3 weeks of getting the cells back that the treatment was effective, and they didn't see any cancerous cells in my bone marrow biopsy that they did as a follow-up. So it was a successful treatment. I was very happy to get that news. But they do know for multiple myeloma patients that CAR T cell therapy is not curative. Statistically, they know that you'll relapse at some point. They just don't know when you'll relapse. So you have to go every month to see your medical team to get blood work done and to just kind of see where things are, whether you're still in remission or not. So for the last 7 or 8 months, I've had to go monthly to get that blood work done. And there's a term in the cancer community called scanxiety. And it's the anxiety that you feel whenever you have to get a scan, a PET scan, a biopsy, blood work. And I have to tell you, it is real, because every month I'm always nervous about getting my results back. And it's nerve-wracking, to be quite honest with you. But I am happy to be in remission right now. And I pray for a deep and long and durable remission. That has been my journey so far with being diagnosed with multiple myeloma. Thank you for watching this video. Don't forget to like, comment, or subscribe to my channel. I'll be doing more multiple myeloma content in future videos. So thank you, and I'll see you in another video.